during the healthcare reform discussions, I decided to use one slide today. We've developed this diagram because, as you know, a lot of the work in the legislative arena as well as implementation is done in silos by different committees or different federal agencies, etc. So if we're going to look at the whole person, then we need to look at the whole system. And what we did was we developed this diagram to show how everything should work together, all the different aspects. And so I just wanted to briefly point out the different parts of this and relate it back to what you've already heard and what you're probably working on in your day-to-day work. We start with the Institute of Medicine definition of value, and that is, it means getting the right care, the right time, to the right patient at the right cost. And from that point of view, and from the patient's perspective, we believe that true value in healthcare incorporates both quality research and the patient's personal circumstances, which, as you heard, includes their genetic, ethnic, religious, and socioeconomic status at the point of care. And it is, as you would imagine, and some of you I'm sure have experienced this, depending on where you are with your conditions and how they're interacting and where you are in your life, your goals are quite different when you're younger than when you're potentially older. You're going to make different decisions depending on what your goals are. Is it to have my child, see my child graduate or get married, or is it to live with quality of life free of pain at the end of life? So at the National Health Council, we describe this entire enterprise as balancing sound science created, we believe, a lot will be through comparative effectiveness research, much of which will be done by Corey. And that's on the left side. We'll take all of the research and the tools that you've heard about, and they feed into the process. Then on the right side, this is where we have really done some research, and like Ken said, there are good best practices all around the country of how to do most of this, but it is to really have the right person sit down with the person, their family, their caregivers, whomever they would like to have with them, and do a comprehensive assessment of their life. They're not just their diseases, but as I said, their life goals and their personal situations and beliefs. Once you do that, then there needs to be, with that individual and their family, an individual care plan developed. And this would be a plan that, taking all that into consideration, is the treatment or lifestyle plan that they will have helped develop and be based on their needs and preferences, and therefore we believe that their buy-in and adherence, and we know it will be significantly better, so we have better health outcomes at lower cost. And then the last two parts, you've heard mentioned the importance of care coordination. And we believe this could be done, a lot of this by a physician, certainly could, but it can be done by social workers, it can be done by various levels of nursing. And so there are creative ways to do this and have potentially some new roles in the healthcare system develop over time that are not dependent as much as we are today on having a physician carry this out. And so we feel that this care coordination, which involves the electronic personal health records and electronic medical records that are critically important, I think, not only to doing the research, to providing the best care, and to having people feel that they are having their information shared appropriately. They don't have to go to places and pick it up and have care delivered in, again, silos, but it's truly coordinated. And a critical part of it is having it paid for. So that's what the reimbursement is at the bottom. And then finally at the top, we get back to the value-based benefit design, and that really for us means that one important aspect is looking at how much does the person have to pay out of pocket. Again, there are many studies, there are a lot of data to show when those out-of-pocket costs go up, the person's ability and desire to take care of themselves appropriately go down, and so therefore we have worse health outcomes and clearly cost all of us a lot more. So looking at out-of-pocket costs is one absolutely critical aspect for which there is data to show when they go up, care often goes down, and we need to find ways to not have that happen.